joining, I will introduce Prof. Tope. So, Prof is a professor of family health, and he's also the dean of the University of Ghana School of Public Health. He has many years' experience as a physician scientist, researcher, program director, and trainer. He's a graduate of the University of Ghana Medical School and obtained his Master's of Public Health in International Health from the Netherlands School of Public Health and his PhD from the Institute of Tropical Medicine in the University of Antwerp in Belgium. Prof is a fellow of the Ghana College of Physicians and the West Africa College of Physicians as well, and is an honorary associate professor of the London School of Hygiene and Tropical Medicine, and an associate fellow of the Amsterdam Institute of Global Health and Development in the AMC at the University of Amsterdam in Holland. He is also the scientific chair of the International Conference on HIV, Pathogenesis and Prevention Research in Resource-Limited Settings, better known as INTEREST, and the first African to serve in that role. His work is largely focused on infectious diseases, and I guess you can understand why I'm excited that he'll be hosting us, facilitating today's workshop. So, Prof. Tope, your audience, and I believe we'll be having an enjoyable time today. Thank you very much.
Thank you very much, Charles, and good afternoon, everybody. It's really a pleasure to have this opportunity to engage. And I mean, when the Pediatric Society reached out in terms of collaborating with us to try and help develop capacity of members of the society, particularly in the area of research, I was very, very excited. And then the reason is simple. You see, they always tell us that we doctors don't do good science. And it's an accusation that's basically is fairly common in the university. And the reason is simple, that a lot of us, we are hardcore clinicians. We spend a lot of time doing clinical work. And then despite all the things around us, we really don't do enough research. And I think we really need to build a core that will change this narrative. And I'm happy to be part of that group of people who want to advocate for that change. And then also, before I start, I know within the University of Ghana, the medical school, there's an active effort to try and strengthen the research component of the training. And basically, we are also looking at people in the fellowship programs that by the time you finish the fellowship program, you can also get a PhD. So these are things that we are looking at, and then I hope this will go a long way to support us to do good science. When you go into other countries in the US and then also in Europe, in medical school, there are people who are identified and then they take what we call the MD PhD track. So they are clinicians, but they also train to be scientists. Some do the MD and PhD track. See, we don't have that here. So in the end, we have to do it this way, where you have graduated, and then we really have to get into build your capacity in the area of research. So today I'll be talking about framing a research topic, and it would be what I'll say, a relatively interactive presentation, short, but then what I'm going to do that after the didactic presentation, I'm really going to engage with almost all of you for us to look at where we can assist. So, for example, if you have plans of doing research in your facility or in your community, we can discuss, and then I can basically help you come up with some research questions that you can do. And you must also understand that if you may be a very, very, very good clinician, but for you to be an outstanding clinician, you must be a clinician plus a researcher. Because when you become a researcher, then you can push the frontier, the boundaries of knowledge. You can push it from where we are today to new areas that nobody dreamt of. That is the mark of an outstanding scientist. And I think we need to all aim to do that. All right. So, like I said, my name is Kwesi Tope. I serve as the Dean of the University of Ghana School of Public Health. Good. So, framing a research topic. Now, in terms of the session lessons, the objective of this session, by the time we finish, you must be able to select a research topic. So if you have not, then you need to at least have an idea of the area, because I'll be going around and asking and then see how best we can support you. And then also not just selecting a research topic, but developing good research questions. Okay, good research questions. Yeah. So now let's get into the research topic and the research question. Now, if you look at the research question helps you define the topic that you want to work on. And then also, it will help you define the nature of the research. So you see, the research question is really paramount. It drives many things, okay? Then, of course, the question will define the boundaries. When you say define the boundaries, for example, it will tell you the population you want to work with. Is the population in the health facility? Is the population in the community? So it basically sets the boundaries. It can also give you in terms of the time frame. So all this information will kind of direct you to conducting the research. And normally when you do all these things, it will actually help you on the type of research that you have to do, the design of the research that you have to do. So this is extremely important, and it's one of the early things that will guide your work, particularly in the area of research. All right, I hope it's clear. So now getting the research topic. So now we are talking to pediatricians. So if you look at child health is a very broad area. So you look at yourself. Which aspects of child health interest you a lot? So you may want to work in the area that interests you, or maybe in your work, you have observed something happening to patients in a particular group, and you really want to inquire, you really want to study. And then also, you have read an article, and the article has piqued your interest in specific areas. And sometimes, like we go to conferences, and then people present abstract. Now you read the abstract, say, this one, I can do it in Kolebu and my teaching hospital or my regional hospital. Then you start looking at it within your setup. And then also, it has to do with current issues. What are the burning issues in the field of child health that needs answers? Then you can look at it. And then also, it's important that you look at the stakeholders' needs. And when we say stakeholders, for example, if you want answers, Ministry of Health, Ghana Health Service needs answers to specific research questions. Or even within the hospital, specialists, there are different protocols of managing specific conditions, and we are not sure which one is better. So basically, the medical community really wants answers, okay? And then, of course, we look at what the literature says. What does the literature say about the specific area? Now, getting a research topic is interesting for people like us, and I can see Prof. Keno is also on. We do different kinds of research. For example, if I look at my research portfolio, maybe 70% of the research I do, people commission me to do it. You understand? So stakeholders will come to you and say, we want answers to this research question. You understand? And then, of course, if they commission, they have to pay for it. So then roughly maybe 30% of the research are things that I am interested in. I will do a proposal and try and seek funding to answer those questions. So it will really depend on where you find yourself, whether your research is something that somebody comes and say, I really want to study this, and then they have money for it. Or it's something that you have around you that typically, even in the beginning, you may have to self-sponsor. I mean, maybe a low-cost research that you can start. So these are some of the things that will actually move you in getting a research topic. Any questions up to this point? Good, no questions. So I assume we are on the right track then. All right. So there is something we call mind mapping your interests. So which areas of child health interest you? And then which aspects of these child health areas you think you want to do more work? So maybe I can Tunde. Hello, Tunde. Okay, Haruna.
Yeah. Hello.
Yes, Haruna. You see me when I'm doing the virtual presentation. I like to call on people so that we engage.
Prof, that's
okay?
fine.
Yes, all right. Please. So Haruna, tell me, which areas of child health are you very much interested in?
All right, so I'm interested in nephrology.
Nephrology.
So kidney diseases in children. Yes, please.
Kidney diseases in children. Okay, so kidney diseases in children. Now, within the kidney diseases, within the kidney diseases or the nephrology area, which aspects do you think you want to know more or you want to investigate?
So the area I want to know more is acute, that is congenital anomalies of the kidney, the ureters, and then the urinary tract. Sorry.
Okay, so you see, so straight away within the child health, you have the broad area, which is the nephrology. Then as you go deeper, then you are looking at congenital anomalies affecting the area. And you see, when you start doing this kind of mind mapping, then your questions will start coming together. And I'll come back to you. For now, we'll not do the questions, but I want to finish the presentation. Then we can come back and then try and see some of the things that we can do. Okay. Fumi. Fumi. Okay. Mamia.
I'm here, sir.
Oh, Fumi.
Fumi is here.
So Fumi, talk to us.
Yes,
what
sir.
areas of child health interest you?
Actually, I want to do something on urinary tract infection in children.
So when you go to UTI in children, you've jumped too low. You understand? You have missed a step. You need to look at the broad area, isn't it? So if you are saying broad area, you can say maybe infectious diseases or maybe kidney diseases. Then you go down and you say urinary tract infection. I hope that makes sense. Hello, Fumi? Hello, Fumi? Okay, I think you've probably... So let's go. Mamiya, what about you?
Yes, sir. I understand, sir.
Okay, good. Excellent. Mamiya, what about you? Emily? Emily? Christiana? Sam? Emmanuel?
Yes, Prof.
Uh-huh.
Yes. So my broad area of interest is in neonatology. I'm
Neonatology. Very
particularly
good.
interested in prematurity, and lately I think I'm more interested in retinopathy and the
Okay.
complications of prematurity. Currently, I'm interested in retinopathy of the
All right.
prematurity. Yeah.
So,
Yeah.
excellent. So this is the way, okay, Mami, I say you can't talk childhood nutrition and nutrition across all the ages. So this is the way you work your way and then get into your research question. Well done. So let's move on. So now, in getting the research topic, one of the things that you have to do is you have to read. You really have to read because you see, you meet people that say, oh, I'm interested in this topic. How many papers have you read? 3, 4. No. Because you see, when you read, then you start seeing the different angles of what you want to study, what other people have found. And then at a point, you see that there are contradicting findings. And sometimes these contradicting findings are coming from the different study designs, okay? So it's important you read and you know the state of the science. And then you need to attend seminars, you need to attend conferences, and then also try and pitch yourself, make presentations, let people ask you questions, okay? And it helps you, actually gives you a 360-degree view of the subject area that you really want to study. Then you also will need to study the area with the peers, your colleagues, you discuss with your colleagues, and also your seniors. Because sometimes, like if you come to me and maybe you are interested in a particular area of infectious disease, I'll tell you this area is dead and buried. I mean, most of the issues, the key issues have been addressed, and it's really not something that a donor would like to put their money into. So when you discuss with peers and even your seniors, then they are able to provide you some guidance. And then it's always important to listen. You listen to your peers, you also listen to your stakeholders, because sometimes you attend these conferences and then they'll tell you, we are struggling, our treatment outcomes for this condition is not very good. And then you see all these problems around you. Then you say, I really also need to be part of the solution of these problems. And then to further understand, you need to ask questions. What is it that they are doing? Are they doing it right? Okay. So all this would help you, one, get the research question and also try and frame it a bit. All right. So now, for you to perform significant research, so I'm talking about not just research, but significant research. Now you need to know the research agenda for the country or the institution that you work for. For example, if you look at the medical school, College of Health Sciences, there are a lot of research areas that is priority. For example, we are looking at these non-communicable diseases. We are looking at maternal and child health. We are looking at infectious diseases. And then we are looking at how you can use artificial intelligence, machine learning, and all those things in healthcare. So there are a lot of things. So if you are able to do something in the area, then you make a significant contribution in the advancement of knowledge in your hospital or in the country. Then, of course, you have to have a good knowledge of the health status of the population. Now, I'm sure if you look at the data in terms of the infant mortality, neonatal mortality rate, early neonatal mortality rate, straight away, you start seeing the problems that we face as a country, particularly among the pediatric population. So you need to have that knowledge, and then that would help you as you are developing the research, can allow you have something that is significant. Because you see, we do a lot of research, but only impactful research will make it up to the top, and then you'll be cited for the rest of your life. Okay. Then also, before you also get on, you need to understand what other people have done. What has been the previous research that has been performed in the area? Yes, it's good to repeat what other people have done to confirm, but it's even better if you move it a notch up so that you build on what they have done and also find new things. Then finally, you need to understand that what are the things that we don't know in the area. So that is the knowledge of the needs and then the gaps in the area, the gaps in literature. Then if you are able to do it, then you too, your name will be written in gold. So these are some of the things that you really need to think about if you want to perform significant research. Now, one of the things we also say is that the research that you do must be feasible. It must be feasible because somebody has to pay for it. If you have a donor that can handle the research budget, then you say, okay, then this is feasible. So, but if you do not have money, then it means you have to consider a low-cost research. And there are different ways, there are different study designs. And I think in the course of subsequent presentations, they would cover that. So, for example, if you want to do a randomized control trial, these studies are relatively more expensive, but you really don't have the resources, you are funding yourself. Then you say, okay, what are the alternatives that I can do? Can I do probably a quasi-experimental study? Can I do it really depends on the availability of the funding. And then also, it depends on the availability of the equipment, because sometimes, there are some studies that we are involved in that we take the samples here and then we ship them to Europe or to the US to do further tests, because we really do not have the equipment here to generate the test results. So you need to take all this into account. If you have to move the samples to the US, then you have to know that there's a paperwork that we have to do in terms of shipping materials. IRB, if you are getting the ethical approval, there's what you call the material transfer agreement. You need to know all these things, and all these things will go in to determine whether your research will be feasible or not. And then sometimes the time frame, you really want to find out how long will this study take. Is it 6 months? Is it a quick and dirty study where 3 months you can get results? Or like you want to do trials, and most trials, we are talking about between 1 to 2 years, depending on what your outcome is. So you have to look at the time frame, and then do you have the human resource to support you? So the research that you do must be feasible, and you must have adequate resources to be able to perform that research. Otherwise, you start and then you may be stuck in the middle. So I think we've spoken a bit about some research areas, told me nephrology, some are talking about nutrition, neonatology. So there are different options. I'm just giving some example: malaria and pregnancy interventions. If you are interested in oncology, treatment outcomes for new treatment, hepatitis B, bed dose. This is something that Ghana recently started. How is it doing? elimination of mother-to-child transmission in HIV, sickle cell, the new treatment, and then anything on specific interventions for specific pediatric conditions and then outcomes that it generates. This morning, I was teaching another class, and then I was telling them about the hepatitis B vaccination. And actually, I used my kids as an example. I mean, they took this Hep B, I think 2001 and then 2003. And then somehow something happened, and then we needed to do medical to show that they have been truly vaccinated, because I showed the vaccination card. They said, no, we don't need the vaccination. We want the titers, the Hep B antibody titers. And then we did the Hep B antibody titers, and there was nothing in the blood. There was nothing. It was zero. So you understand? So basically, we have vaccinated these children. We have the card to show they have been vaccinated, but there is no antibody response to protect them. This could easily be a research question. You can do titers and say the measles and rubella that we are giving, are they generating titers? If they are not, then what is the problem? Is it the cold chain? So all these things are things that we can look at, because if you do and you realize that the children are not generating the antibodies, then that will be a big policy issue and also operational issue for the Ghana Health Service and then the Ministry of Health, because it will allow them to go back and check, is our cold chain foolproof? So in terms of research, what you can do, and in terms of the interest, is actually limitless. So now, as you start getting the idea, then you need to start refining the research question. And then refining the research question, then you have to start asking, because you have the idea, now you have to start asking the research questions. And typically, you can ask 4 or 5 research questions. And then, of course, you also need to review the literature, and that process will help you in developing the research questions. And in the process, you also have to make sure that you discuss with people, and they may shape the way you want to look at this research question, and then refine it appropriately. So now this is the 4-step question generation process. So the first one is, what is your topic? What do you want to do? So what is your topic? What is the context of your research? Where do you want to do it? Do you want to do it in the community? Do you want to do it in the school? Do you want to do it in the district? Do you want to do it in the whole country? Or you want to do it in the ecological zones of Ghana? Then you ask yourself, what do you want to achieve? Do you want to discover new things? Do you want to describe? Do you want to change the way we practice our medicine? Do you want to explore? And all this would influence the design that you use. What is the nature of your question? Like the what, the who, the when, the where, the how, the why. So all these questions would help you basically hone in what you want to do. And then sometimes you want to understand, are there relationships between, say, certain variables and the outcome? Does treatment A improve somebody on, let's say, prophylactic medicine? Does it improve a particular outcome? So these are the relationships that you also want to explore. So there are a lot that you can do in this, and then this will help you in refining your question. Now, as you go through that, then you begin to refine the question. Now, you refine it to a point where you come up with maybe your one question or a few questions, because you see, as you go, you narrow down. Okay, you narrow down, and then you try to get to exactly what you want to do. Now, if you have developed more than one question, then you have to decide what your main question is based on your interest. And then also feasibility, because sometimes what you are interested in may not be feasible. So then you have to move on to what you think is feasible and then you can do, or what you think when you do is going to be very impactful and everybody will like to actually see the work that you have done. So the step 4 is narrow and clarify until your question is as concise as possible and it is very well articulated. So by the time you get to the last stage, your question should be ready to go. So now if you want to develop the research question, I mean, traditionally, you may want to write out the questions you want answered. And typically we say don't start with too many questions, because you see, when you start with too many questions, it gets a bit they all crave for attention. So you try not to start with too little, but also not too many. And typically we all say 4 or 5 questions from the beginning is good. And then from there, you can start working your way forward. Now, I think all of you have had some experience in research from medical school. And then, I mean, from medical school, the expectation is that you have to do something to get your degree. But as you move into practice, I think it's always important you understand that you need to go beyond the basic research requirements. You need to try and do studies that can make an impact to educate us more or help us change our practice, help us change our protocols, okay? So now your question will help you define the body of literature that you need to be conversant with and then eventually review. And I always used to joke that, you know, depending on the level, for example, if you are moving towards fellowship, PhD level, before we start talking about your research question, I ask you the number of peer-reviewed articles that you have read. You should be reading at least 40, 50 for us to have a good conversation. Because by the time you get to 40, 50, you've seen the different angles of whatever you are trying to look at, and it will help you fine-tune your question. And I understand, as clinicians, practice just sucks the blood out of us, and we really sometimes do not have a lot of time to read the literature. So as you make yourself conversant with the literature, then you are in a better position to formulate appropriate researchable questions. Now, you also need to understand that you need to be very, very flexible. You see, research can change from the initial phases of your research. You start that you want to do something, but as you get into the field, you understand the nuances, you realize that, this thing has to be tweaked a bit. And then, of course, your reading will also help you. And they'll tell you that if you start with the research question from the beginning and you don't tweak it or change it, most likely that research question is a bad research question. So you should always be open to modify your research question. We've had situations where students come in, they are doing their PhD, and then we start work, we formulate the research question, everybody is happy. But as we start collecting the data and we start getting different information, and we're like, no. We actually have to go back and refine revise the research question, because what we are getting in the field is actually very, very interesting, and I think will make more impact. So you really need to be very, very flexible as you develop the research question. So this is what we call the good question checklist. Is the question right for me? So it's right for you. Is it a question that you think you can do? Is it a question that you think will make the needed impact? Is the question right for the field? You see, they'll always say that sometimes we do research for ourselves. And then we do the research for ourselves, we get the findings, we publish it, and then it remains on the shelf. But the research that you are doing, how is it going to help physicians? How is it going to help nurses? How is it going to help the Ghana Health Service? You see, so how is it going to help the field advance knowledge? So is the question right for the field? And then is the question well articulated? Is the question clear? See, so you need to go through this process. And then is the question doable? Sometimes the question is doable, but it is not ethical. So you can't do it. Or sometimes the question is doable, but it's going to take you 5 years to get an answer to that research question. So you need to look at all this. You need to go through this good question checklist. And then, of course, the question that you want to address, do the experts in the field agree with you? And if you get consistent answers from experts of the field who say, this one, I don't think it's a good idea. Sometimes you ask the experts, and the experts are, there's no consensus. When there's no consensus, then it means it's possible for you to make a breakthrough. You may provide an answer to what everybody is waiting for. So it's always important to speak to others who are experts in the area. So I mentioned the rightness of the question for you and your field. With the question hold your interest? Can you manage the potential biases? Again, you see, sometimes you have an interest in a particular area, and you have already developed biases in that area. So even before you finish your research, you have what the findings is supposed to be. So we need to make sure that you can manage your subjectivities and potential biases. Actually, one of my very good friends is actually a senior colleague, and he has been working on the cause of a particular disease. I'll not mention the name of the disease because, I mean, it's something that is fairly new. And so, and he thought that disease was caused by a parasite. And then they had a team. It was an international team, different countries. And then they did. And then actually, among children, they realized that the disease did not have an infectious basis. And my colleague was not happy. He was upset. And actually, he didn't want the findings published because the findings did not fit the narrative that he had thought. You understand? So it's always very important to remove your biases and subjectivities. And then, of course, how will your findings help in practice? How will it contribute to knowledge in child health? So you need to look at all this, and then that will help you in framing your question. So the articulation is making sure your question is very clear, everybody understands what you are saying, and whether there are assumptions that you need to take into account. Okay. Now, I was asking, is the question doable? So the information that you collect, I mean, you have different variables that you collect in the process. Will those variables answer the question? And you need to be sure. And then again, do you have the skills to collect or assess that information? For example, if you want to do, say, a systematic review, do you have the skills to be able to do the search and pick the information that you need? Or you will need additional training. And then you want to do a systematic review. Do you have the time? Because, for example, depending on the topic and then the time, the time frame you want to look at, It may take you 6 months. It may take you 1 year. So you have to ask yourself, do you have time with that time frame? Can you do that? So you have to look at the time. And then you have to look at the cost. Because if you have to get assistance, do you have money to pay them for the whole period? Of course, if it's a literature review or systematic review or meta-analysis, you do not need, you don't have major ethical issues. But if it's a primary data collection study, sometimes you may have ethical issues because what you are doing, is it going to put the patient in harm's way? It's then, if, for example, if you are trying the new interventions, there's a new intervention worse off than the standard of care. So you need to take all this into account before you can decide this is something that I can continue. Okay. So approval of those in the know, this is the experts. Like I said, the experts typically, if there is consensus among experts that this area has been well studied and I think it will not make a difference, it's better not to waste resources and do something that may be able to help the community. But where there is no consensus, expert A is saying something else, expert B is saying another thing, then it means that it's possible for your work to actually provide more, shed more light on the area. So in terms of the title, I mean, you need to write a clear descriptive title, because you see, when you put the title and the title is very descriptive, it's easy when somebody is searching the literature that I'm interested in, say, nephrotic syndrome in children. Then you can pull out the information. So the things that we always say is that the element that is sometimes good to include is the idea itself that you want to look at, or part of the results or findings, or what you have learned from your study. Having that in the title helps. And then also we say that not always, but you can also for the title, what you did. For example, if it's a randomized control trial, when I'm an editor of a journal and you send me something and you say, this is a randomized control trial of treatment A and B in children with, say, Beckett's lymphoma, that paper will never be rejected. We are talking about randomized control trial here. It will never be rejected because randomized control trial is the pinnacle of science. Now, if you write something and say, demographic characteristics of children with sickle cell disease in Kolebu Teaching Hospital, a cross-sectional study. I look at it, I look at it, I look at it. This one, it's not something that I want to put in my journal. You understand? So the research design helps, and sometimes when the design is there, it's able to showcase the strength of your work. For example, you write a quasi-experimental study. It's an experiment. It's an experimental study. That's a lot of work, and the results are strong. Okay, and then where it happened, the community that it happened, or the country that it happened, the setting that it happened, sometimes you can put it there. And then when it happened, for example, the when becomes important when you look at either a trend or you look at studies that we do periodically. For example, we have this maternal health survey, we have the demographic and health survey. The last one was 2022. Before that was 2014. So those studies, for example, it's important that you put the year so that people will know what you are talking about. Okay, so when it happened. So let's look at some examples. This is the importance of cognitive behavioral therapy for children. Experience in Hohoi in the Volta region. Emily, what do you think about this topic? Hello, Emily, what do you think about this topic? Oh, okay, let me go to Christiana. Christiana, what do you think? Christiana, what do you think? Dorcas Amankwa, what do you think about this topic? I hope I'm not talking to myself.
One paper some years ago by
Prof,
I
you are
think,
clear.
they showed that there might be some limited benefit if you start cooling beyond 6 hours. The later you get.
So you can see that this is generally broad. Yes, it talks about cognitive behavioral therapy, but it doesn't tell us what was done. Okay, it doesn't tell us what. So you really need to try and be putting the information that the title alone will give us a sense of what was done. Okay, then this is another one: improving malaria care in communities. Need for emphasis on parental engagement. Again, it's not clear where was it done, what was done, you know. So you need that level of information in the title. So, for example, we can say cognitive behavioral therapy and depression outcomes in children, a cohort study in Hohoi. You understand? So this one tells you the relationship that you are looking at. It also tells you where it was done. It also tells you the study design. You see, so you need to try and frame your topics in a way that, I mean, just the title alone will be able to tell whoever is doing any search that this is probably the paper that I want. So improving malaria care through the engagement of parents in Kumasi, a community-based approach. You understand? So these are all examples that we can give, and you can give many examples. So I think this brings me to the end of the first part of my presentation, the didactic part. And I want to acknowledge my colleague, Dr. Adolfinalati. She'll teach you in the next 2-3 weeks on some of the study designs. And she actually shared some slides with me. So what I will do now is now to engage with you. So for those of you who have some ideas, all you have to do is to just put your hand up. Then I'll call you. Then we can discuss. And then at least if we are able to do for 10 people, the others will be able to learn in terms of how to frame the research topic. And Prof. Kenu, you are there, isn't it? Hello, Prof. Kenu. Okay. All right. So any questions?
Yeah. Yeah.
Okay, good. Yes. Any questions?
Prof, please, I have a question.
Please
With
go ahead.
regards to adding the when in the title. So, for example, like the better titles, like you listed, is it compulsory to always add a specific time you carried out the study?
No, it's not compulsory. It depends on the question that you have selected. But for example, if you are doing something that is a study that is done frequently, if you don't put the year, then it becomes an issue. But if it's a regular study that is not and we have the studies that are repeated frequently. We know them, like the maternal health survey, demographic and health survey, malaria indicator survey. Those ones, they are done frequently, you understand? So those ones, the year has to come to tell us which one. But other regular studies, you may not need to. So it's not compulsory. But what I'm just saying is that these are the elements that you consider.
All right, thank you.
Any more questions? Any more questions?
I see no hands raised, Prof.
Okay, so what about who wants help in terms of generating their interest in a particular area? Who wants help? And let me tell you something. When it comes to research questions and what we can do, we have it all around us. You see, the patient record that we have is a gold mine. It's a gold mine that we really do not harness. And there's so many things that we can do from patient records. So many. So you can design a low-cost research study to cost you very little within a month. If you have some research that will help you, have collected data on a specific question, and then you can actually write it up. But you need to develop that interest. Then don't be too comfortable with your daily routine. You have to move a notch up. I remember many years ago, I was then working in I was in Atua Government Hospital, and then St. Martin's in Agomenya. And I met one senior colleague. You know, those days, you small thing you do, and then you write, and then you stop. And then they asked me, how many conferences have you attended? And I told I've attended many. They asked me, how many abstracts have you developed? So abstract I've done like maybe 15, 18. How many papers have you published from the abstract? I said, only one. You understand? So there are a lot of opportunities, but you really need to push yourself to be able to, move up. Okay.
Thank you very much, Prof. So it's not easy getting professors to be offering themselves their time, asking you to bring up questions so that they can help you, and certainly not deans of schools or public health. So please raise your hands and ask.
So you know something? Let me do it in another way. I'll help you. So anybody should just volunteer. You don't have a question, but just volunteer, and I'll try and push you in a particular direction. Anybody. You may not have a research.
I have an area.
Courses, yes.
Sorry?
Yes. I said I wanted to talk about an area I'm interested in.
Please go ahead.
Okay, so I am involved in taking care of children and adolescents with asthma. So recently where I work, one of the secondary schools around, there was an adolescent that had an asthmatic attack and then unfortunately passed away. So I'm looking at studying how adolescents with asthma have their asthma managed whilst they are in school. See how I can improve upon the care given them.
So how adolescents with asthma have their care managed, isn't it?
Yes.
So then you start thinking about it. So this is what we call a model of care. Now, the model of care, you have to look at what is being done now. That's the standard of care. When they go to school, Do they have their salbutamol with them? Do they have their inhaler with them? What are you proposing? You get it? What are you proposing to do? Are you going to have a model where you say, for my intervention, the children must have the medicine, the Ventolin, tablet, inhaler, blah, blah. You just have to come up with something. Or they need to have regular checkup. Then you ask yourself, what will be the outcome that you want to look at? Is your outcome the number of attacks? Is your outcome the severity of the attack? I hope you get it. As
Yes.
you move along those lines, then you see that you'll be shaping what you want to find. And then, of course, if you are looking at an outcome, say the severity or the frequency, it means the study must take a while. At least it will be more than 6 months. Because maybe when you do it 2-3 months, you may not get the results that you want. But if you plan up to a year will be good enough. And this study, for example, will be a study that you follow up the children. So again, that fits into the study design. You cannot do this work with the cross-sectional study where you go, you separate them, and then bam, you are done. You understand? So this is a very good example of how what you want to do would influence how the job is done and how long it will take. I hope you get it.
Yes, please.
All right. Any other? If
Thank
you don't
you.
have anything, you can tell me where you work, and then we can discuss where you work, and then we can come up with something.
Harness hand was up.
Yeah. Hello.
Yes.
Yes, Prof. So my question is on, let's say, selecting the topic. So when you started, you mentioned that when you are starting, like you're developing your research questions, usually you wouldn't want to make it like a lot of questions. So technically, maybe 4 to 5 is fine. But I'm looking at sometimes when you are carving, let's say, putting your topic together, you want to make sure that you cover as much as possible, because maybe probably from your data source where you are going to get your data, you have a lot of information that you will need to write about. They realize that because of the lot of information that you have to work on, then your title will somehow look a little broader than expected. Because if, let's say, you are making it very specific, then it's like you're narrowing yourself, but you have a lot of data to work on. So in that case,
Okay.
how do you balance it?
Yes, and this is a common issue. Okay, like we supervise students, particularly PhD students, and sometimes the information that they have is so much. You understand? Now, if you have a lot of information, and depending on what you can actually break down your research into chunks. So, like, there are some people, they come with that, you have all the information, but you cannot write about all that information in one paper. So let's try and split it. Let's look at the one that will look at epidemiology. Then we can look at the one that will look at the health outcomes. You get what I mean? So when you have a lot of, you can't attempt to combine all that, because the information is just too rich. And normally when you put it all together in one paper, it will be rejected because you will not make sense. You are talking about A, then in most moments you are on C, you are on B, you are on D. So in such a case, you split it. You split it into areas that make sense. So you can see that one research that you have done, you can publish 3 or 4 papers from it, depending on the angle that you take. I hope you get it.
Yes, please.
Yeah.
Any more questions? Please don't be shy.
All right. I mean, if you don't have any more questions, but you think you need help, if you tell me where you work, I can actually probe, and we can find a research question together.
Nicholas
Nicola,
Chineboa.
Nicholas.
Nicholas.
Yes, sir, Prof. Good evening.
Good evening.
Yeah, please, I wanted some education on, one danger you have pointed out is being too broad. And I really
Yes.
appreciate it because the one about the Ahoy, the beginning statement said the importance of what is importance, but when you came down to the better title, the importance is brought out in terms of the depression outcomes.
Exactly.
So it becomes more specific.
Yeah.
Now, I want some advice on the getting too much on the other side, getting too so specific that it becomes not so useful. How or what will make you too specific not to be useful? Thank you.
Yeah. So, like I said, you see, your research must be driven by something. It must be driven by something. So, for example, the something is, are there gaps in the knowledge? Are there gaps in practice? Are there disagreements in the way we do things? That is where your research question must come. So if it is coming from there and you have only one answer to that question, it is fine. It can even be published in the Lancet and then the Natures, because even though you ask only one single question, that one single question is actually putting an end to a debate. So basically, it's not being specific is good, but it's what you are trying to address. That's why I talk about what is the gaps in knowledge. What your stakeholder wants. So when you do that, and there are a lot of papers where we call it short communication, where they answer one very important question, but that one question will for us as clinicians, it will change the way we practice medicine. But it's just one question. So it is what that question is meant to do. That is what is more important.
Okay, thank you, sir.
Charles, there's a question in the chat.
Let me see.
Thank you very much, Dr. Yaku. Matilda says she can't speak, but she has been looking at a research question that addresses waiting time and factors that influence patient time, I'm guessing spent in her hospital, comparing pediatric and adult OPD clinics. And she's asking, is there any help, I'm guessing, to refine the question?
So waiting time, there are different ways to do the study. The study can be, for example, when the person comes to the clinic, you give them a time, and then they move through. So by the time they go through, they see the doctor, everything, pharmacist, and they are ready to go. You take the time, and then you interview them, and then they may tell you their satisfaction with the service, whether they spend too long at the OPD, or they spend too long at the consulting room, or they spend too long at the... So that one is there. And then a study like this, you can complement it with what we call a time motion study, where within that same study, you sit down and observe, let's say, the doctor. When does the doctor come to the consulting room? How many minutes does the doctor stay in the consulting room? How many patients do they see per minute? How many times do they go out, say they are going on break? And you can do the same for the nurses. You can do the same for the pharmacists. When you do this kind of study straight away, and you tie it into how long the patient stays in the clinic, and then their feedback with their interaction with the clinician, that's going to give you a lot of information for you to clean up your patient flow. You understand? Because sometimes they'll say, oh, the doctors will tell you, I'm seeing too many patients. But when you look at the number of patients they see, because they'll come to the consulting room at 10, by 12, they are drinking tea. And then they start again at 2, and then the patients are waiting. So all this would help you improve the efficiency of your patient flow. This is a very, very, very good study. It's a health system study. And it will help your clinic do better. People will come because they know that at this hospital, when we come within 30 minutes, everything is done, because it helps you improve your performance. It's a quality improvement approach. Okay, so this is something that can be done in any hospital, especially most of our hospitals where we are struggling with patient flow challenges. So this is really very good. I hope that addresses it. So now this one is looking at factors influencing treatment adherence among diabetic patients. So if you are looking at treatment adherence, maybe it depends on what you want to, because for example, the treatment adherence, there are different ways to ask them. Number one, you can ask them the number of pills or injections they missed, or whether when you give them appointments to come for refills, whether they come on time. So that will be one way to measure the adherence. And then, of course, you have to look at the outcome. The outcome is for example, their fasting, the fasting blood sugar, hemoglobin A1C. Then you try to match. And then sometimes you realize that they tell you the adherence, but the adherence is not matched by the outcome, which is either the fasting blood sugar or the hemoglobin A1C. Okay, and then also one of the things that you have to think about, especially for diabetes, and we've done some work. I think if you want to do a work like this, it's always nice for you to add some elements. Adherence is fine, but you know, there are other factors that may be important. For example, exercises. Like we've supervised PhD students where they are taking drugs, they've incorporated exercises, maybe a number of hours in a week as an intervention. And then they will compare that with the one that is just taking the drug and even adherent. And then you see what is the outcome. So when you see that those who are exercising are doing well, then the hospital can say, you know something, let's have some kind of a place within our clinic where when these people come, they can maybe use skipping rope or do something, you know, introducing exercise as part of the care. This is how we make changes in the care we provide. I hope that is fine. Now, there is the risk factors for prematurity at the Suyan Teaching Hospital. So you are looking at Suyan Teaching Hospital. So we know the traditional risk factors, but what you actually can do is there are normal ways you can do this. Because you are already saying you've defined it 2024 to 2025, it means that we have to start from the deliveries in these periods. I mean, among these deliveries, who was preterm? You understand? And then who was at 10? Then we go back, then we look at the different factors. For example, did the mother have hypertensive disorders in pregnancy? Did the mother have whatever, any of the, let's say, a brochure or whatever. So you look at the different factors you want to. Sometimes you can say you want to even look at some of the socio-demographic characteristics. What is their age? Are the young people delivering at preterm? Is the socioeconomic situation affecting preterm? You know, so these are things you can do, but you must make sure that the risk factor that you are looking is in the records that we keep. Because sometimes you want to look at it, but when you go into the records doesn't have all the risk factors. If the record doesn't have all the risk factors, then it's very difficult to do a comprehensive study. So that's why you always need to try and understand what is feasible. If all the risk factors, because when you read, you know the risk factors, then you go and check our patient records. Do we collect all that information? Or sometimes we are supposed to collect that information, but that information is not available because we don't feel it. Okay? All right. Yakubu, I'll come to you soon. This one is assessing parental knowledge and practices on antibiotic usage at heart. So this is a straightforward cross-sectional study. It's very easy to do. So basically, the knowledge, you can decide, it can be knowledge, it can be attitude, it can be practices. Then, of course, you can, the antibiotics, you can decide whether it's a whole broad range of antibiotics or specific antibiotics. So this is a pretty straightforward question, and it can be done very, very quickly, low cost, okay? Because it's a cross-sectional study. Yes, now Yakubu, you can speak.
Cosmos.
Cosmos, I think you raised your hand.
Yeah, you're still muted.
Hello, Prof.
Yes.
I have a quick question. So sometimes we have academic days and people will put together some information on data they have collected and present. And then again, with all these questions that are coming up, many of them sound like things that are simple and easy to do. The question is, which ones do you definitely need ethical approval for? Do you need ethical approval for every one of them?
Okay.
Thank you.
Good. So typically, for primary data collection studies where you interface with patients, you need ethics. Okay. When you have, like, if you look at a lot of the studies, like somebody is saying that retrospective review, you are just looking at the patient records and you state that there are no identifiers. Normally, what we encourage you to do is that, you see, such a study, technically you may not need ethical review, but you have to go for ethical review and they give you what we call a waiver. They'll say that, this one, you are not interacting with patients, there are no identifiers, so we waive. And you get that certificate, the waiver. I'm saying this because, you see, if you yourself decide, oh, this one doesn't need ethics, and then you do the work and you want to publish, these days, almost all the journals will ask you, where is your ethical clearance? So when they ask you, you see that you are stuck. You are completely stuck. So what you do is that it's better for you to, like Kolebu, for example, if there is the IRB, you say, I want to do this review. They say, oh, this one is a patient record. It's something we collect routinely. So we are writing to you and say you have a waiver. It's better to show the waiver than do the work and you don't have anything, because some journals will actually reject, even though technically we know you did not interact with patients. So it's always safer to get the ethical review, and then they'll say, this one you don't need. So they make the determination and tell you, and you put it on file. I hope it's clear. But if you don't do it and the work is complete, it's very difficult to go back. And there are some places like, I used to work in Nigeria, and what we did in our projects, in the facility, that we got what we call a blanket waiver, where the ethics people gave us a waiver that anything that has to do with patient records that there are no identifiers, we give you a waiver. we give you a waiver. So when we publish, then we add that. So when the editors ask us, then we show them. Okay? Yes. I hope that's clear.
Thank you. Very clear.
Prof, there's one more in the comment section.
Oh,
So
sorry.
Rosemary asks that
Yes.
her,
Yes.
her
So Rosemary, I'm not sure of the design, but reading it alone tells me that you want to do a qualitative study. Because you see, the qualitative study, they like to do the explore. You understand? So explore. So this is likely to be a qualitative study. So for qualitative study, there are different things that you do. You can do what you call a key informant interview. So key people. So you may interview the adolescents themselves. You may interview the caregivers. You can also do what we call a focus group discussion, where you put the adolescents together and then you have your questions that are looking at some of these psychosocial effects and then the coping strategy. And you see that if you put like 6, 7, 8 adolescents together in a room, and normally you should try to let their ages match. You don't put old adolescents and young adolescents together. You need to allow them to speak freely. So if they are 10 to 12, they can talk. Then the 17, 18 people too can talk in their group. You understand? Then they will give you the different dimensions that you want. So this is something that you can do, but you need to design the qualitative study very well, because as you do that, if you do the focus group discussion, then you can get the different psychosocial effects or the coping strategies that these children actually use to help themselves. And then as you get it, then you start organizing it into themes. Then you can say this, that. So it's more likely to be a qualitative study. Rosemary, I hope that is fine. Okay. Now let's go to, I'm seeing something on factors associated with seizure control. Factors associated with seizure control amongst children attend a clinic. So this is likely to be a cross-sectional study. You go to a clinic, and then it depends on the clinic whether you want to do the clinic in the OPD, and within the OPD, you'll be checking those who have how do you call it, seizure disorder or not, or you want to do it in a neuro clinic where those who come have a seizure disorder. Then you interview them, then you can look at some of the factors, whether and of course, if they have seizure disorder, some of them may be controlled, some of them may not be controlled. Then you look at the factors that may influence that control, and you may have to read to identify what those factors are. Then from there, you can map those factors to the outcome, which is seizure control. So they either have control or they don't have control. Then you can say that children on this treatment are likely to be controlled, or children who are younger are likely to be controlled on this medicine. So it's an association that you make. Okay, so that is a cross-sectional study. And again, this is something that if you read about the factors, then it may not be too difficult to do that. So clinical characteristics and survival outcomes of preterms less than 32 weeks in a tertiary hospital. Clinical characteristics and survival outcomes. So again, this one can have different designs. You can go and let me see. Oh. Yes, and survival can in preterm less than what is it, 30 preterms less than
32 weeks.
32 weeks. Yeah, I'm trying to scroll, and yes, less than 32 weeks. So again, how do you want to design the study? Do you want to go and look at the preterms born less than 32 weeks? So it means for those ones, you probably have to go to the where they keep the preterms. Okay, then again, you have some kind of checklist in terms of what they have, the characteristics that you are interested in, and then you look at the outcome. So the outcome basically, you can decide that your outcome will be mortality. Okay, can be mortality. So you look at the characteristics and how it influences the outcome, and then from there you can start drawing associations. And you say that for the pregnant women who did A, B, C, D, and then they had preterm delivery, the outcome was better compared to the others. So again, this is something that can be done from the retrospectively. It can also be done, but that one will take long. It can also be done prospectively, where you have the mothers from the beginning, and then you follow them up to the end, and then you want to see those who have preterms, and then you look at the characteristics in the mother that is linking to the preterm. Okay, but that would be more expensive because you have to follow the individual women. But when you go and then you lay ambush, let's say in the NICU or whatever, there you have that captive audience, and then you look back, you look at the records, and then you have the characteristics, and then you build your data set. Josephine. Impact of childhood cancers on parents' well-being. So you first have to define what the parent well-being is. Okay, what the parent well-being is. You have to decide whether it's the psychological well-being, is it the financial well-being, and then, for example, if you want to look at the psychological well-being, there are tools that you can use to measure that. Okay, and so you can do this as a quantitative study. You can also do it as a qualitative study, or you can actually do it as a combination of qualitative and quantitative, where you can go and interview the parents. Okay, or you can do key informant focus group discussion among the parents. Okay, so you can do both. All right, but you need to define what your well-being is, because the well-being as at now is English. We'll have to turn it into exactly what we want, what we mean by the well-being. All right. Clinical characteristics and survival. Oh, yes, I've done. Look at this already. Good. Any more questions before I sign off?
Prof, sorry,
Yes.
Dr. Charles, can I talk?
Yes, please. Please go ahead.
Okay, all right, thank you. So as a Pediatric Society of Ghana, I think over the years, we've done a lot of work, advocacy in many different areas. And one thing that we've been thinking about is how we can measure our impact. And I know it will involve generating a research question and all. The activities are many and in different areas, but just broadly, what would you suggest would be the best approach?
So
Thank
this,
you.
I mean, yes, we've done some of this work in other things that we do for WHO. So work like this, what you have to do is that, you see, you need to do something descriptive. Okay, something descriptive, and say, Pediatric Society, these are some of the activities that we have done. But before then, this was the status, and we've done activity A, B, C, D, E. Now, impact is a big word. Let's just use outcomes, because impact takes a long time. And then you have to select your outcomes that you want to measure. Let me give you one example. Your outcome could be even just awareness among the policymakers. It could be just awareness among the pediatricians. Your outcome could be let's say, changes in policy, changes in guidelines, or an attempt to address the advocacy effort that you have made, where the ministry or the Ghana Service say, yeah, because this has been advocated, we have to change the guidelines. That can be an outcome. So there are different things. For example, if it's an outcome that has to do with education, has something changed? Are more residents training? That can be an outcome. So it really depends on the area, and the outcomes can be many. It can be changes in practice, it can be awareness, it can be the way whether certain things are acceptable by the pediatricians, So you may have to look at all those things compared to what you put in. For example, if you are increasing awareness, you are sensitizing people, then your outcome has to be some kind of awareness, and then also changes that has been made, because the awareness has led to people to be more informed, or something like that. So sometimes when you do and you realize that Charlie, I've done this thing, but I don't have anything to show. What you can always do is that you could do, for example, if you are your target population is a child health people, you could do a quick survey, and then you touch on some of the areas that you have worked in, and then assess what they tell you, and then that's data, you can use it as your outcome to back some of the processes that you have gone through. So there are different ways that you can handle that, but it's certainly doable.
Thank you.
So comorbidities in children with epilepsy affecting seizure control. So again, this is similar to the other one that we talked about. So you have to look at the comorbidities. What are the comorbidities of interest? And the comorbidities of interest will come from your review of the literature. Okay, it will come from your review of the literature. And then the other thing you need to keep in mind is that, have those comorbidities been diagnosed? Because there are some of the comorbidities where it is obvious and it's been diagnosed. But when you are enrolling them, maybe there's a comorbidity, we don't know. You have to investigate and find that comorbidity. So you need to look at all that, because, for example, if you are investigating and finding that comorbidity, then you need to understand that the cost of your research will be higher. And can you afford that? Or you want to wait and then let them and get the outcome, that's the seizure control, and then go back and check the records. And if you do that, that is possible. It will be cheap. You can do it quickly. But you must understand that you may have some comorbidities that may not have been diagnosed, especially if it is subclinical. Okay?
Thank you very much, Prof. By way of disclaimer, that Charles Martin Dickens is not me. Some people couldn't join with the QR code on the poster, and I happened to share my link. Lily Lai, please, Lily Lai, you have the floor.
Okay, good.
Thank you very much.
All right.
Please, can you hear me?
Yes, Lily, please go ahead.
Okay, Prof, please, I want a suggestion on a research tax.
Sorry?
My work.
Lily, there's a bit of feedback.
Okay. Better.
Yeah, it's better.
I was saying I want a suggestion on a research that I can do. You're asking that we can tell you what's happening at our workplace and maybe what we can do.
Okay. All right. Where do you work?
I've recently moved to, formerly was called Tema Polyclinic, Community 2. Now it's called, it's been upgraded to a hospital. So it's Tema Urban Hospital.
Okay. Nice names, but same facilities.
There was no pediatric department per se there. So it's like now I'm to help set up the pediatric department. So we have a place that has been found. I can do in the pediatric department. I don't know if it will be a retrospective study to maybe the numbers that came to the place before I came there, or I don't know. something?
No. So there are a number of things you can do. You are now starting. So it will be very, very nice where you can maybe do a simple survey at the outpatients about what they think about the services that they are receiving, the quality of the services, okay? The quality of the services that they are receiving in the hospital and whether they are happy, okay? So you can do that survey, you can do it among parents, you can do it among the parents, you can do it among and whether they think we need to set up then you have that one. Now you have your pediatric unit running. Then again, you can survey them and add that but this one will be different sets, okay? Because the first set may not necessarily be the same. Then you can ask them, is there any improvement? Are they spending a shorter period? Are they happy with the quality of the pediatric care that they are giving? And then you can compare these two and see, and see whether there has been a change. If they come and you set up the pediatric and say, still, you are not doing well, then you have to lace your boots and improve things more. I hope you get it. So
yes. So this study, will it partly be retrospective and then partly ongoing?
No, this one would be, it will be cross-sectional, but you probably may do the cross-sectional 2 times. You may do it at different time points.
Okay.
At different time points. You may do it at different time points. You do time point A, where you are just about to, so that will be your pre. And then when you start implementing, maybe after, say, 3-4 months, then that will be your post.
Okay.
You get it?
Okay.
And there are simple things you can look at. You can look at how long does it take them. When they were going to the general OPT, how long was it taking them others? Now they are coming to your pediatric unit. How long is it taking them? If they are spending 1 hour in the OPD, and then you come set up your pediatric unit and it's taking 1.5 hours, then it means you have gone backwards. I hope you get it.
Yes,
and then you can do simple things. Satisfaction, patient satisfaction. Are you happy with the service? Before and after.
Okay.
I hope you get it.
Yes, please. So the patient satisfaction, that can be a topic on its own.
Oh yeah, it can. It can. Okay. And then if you do the patient satisfaction, they can tell you the different areas that they are happy and unhappy about.
Okay.
Yeah, somebody was talking. There is for a title. I think the title, the length depends on the journal. It depends on the. I don't know it offhand, but I know, like University of Ghana, there are regulations in terms of the title. Let me see if Prof. Kenu is on. I don't know it offhand, but they are. So you have to find out. Because if your title is too long, they will say, no, revise it. And you also have to, your title has to be, I keep saying, you keep it sweet, short and sweet. I mean, you don't have to do 4 or 5 sentences for a title. Title typically goes 1 line, another line, and then that's it. But you always have to check whether it is a journal or whether it's a thesis or dissertation. Normally, there's a number of words that you can use for a title, and that you need to check. I don't know it offhand. All right.
Supposed to be less than 21 words.
Prof. 21 words, right? For the UG, 21 words. Okay.
Thank you very much, Prof. Kenu and Prof. Tope. A question from Safako in the chat, and I think this possibly would be our last one, is to assess the impact or outcomes associated with pediatric advocacy program. Is it always mandatory that we conduct a pre and post program evaluation? And what if there's no pre-program evaluation? Can we still evaluate the usefulness of the advocacy carried out? She possibly
yeah,
missed.
you can. But you must understand the limitation of your study. Because if you present only one time point, somebody can challenge you that there was no problem in this facility. What are you talking about? You are saying things were worse, but where's the evidence? So you can, it's just that it's not as strong. The quality of the evidence is not as strong. So you may try to do within that final outcome, you need to probably do a qualitative study within it and ask them to, so 2 years ago, how was it like? You understand? You may not have the empirical evidence, but you can ask them 2 years ago. Oh yeah, 2 years ago when we came and this thing was like little like this, and now it is like this. That is a point to compare. I hope you get it.
Yes. Thank you very much, Prof. Any further questions? If not, I think I should.
Maybe, Prof. Kenu, any final words before we log out? Because if you are on, you should tell them something. I mean, Prof. Kenu is also a physician scientist like myself.
Oh, okay, Prof. Thank you very much. I think you've done a great job with them. Probably what we'll be doing is once they start, there's a lot of echo. I don't understand. So I'm saying that what would be best is when they start coming out clearly with their titles, then we can help guide them. Again, then when we do the study designs, because if we get the design wrong, then it means that we are not going to answer the questions properly. For the other question on just doing an endpoint without a baseline, we have to look at maybe quasi-experimental study and look at the program data to help with the baseline. Else, it's just going to be one point and it will be difficult for you to say this has been the change or the impact. But on the whole, I think that it's been a great session. And I also love the interactive parts. Thank you. Over.
Thank you very much, Prof. Kenu. And thank you, Prof. Tope. And commendations again go to the president of the Pediatric Society, Dr. Boy, and the head of the research committee, Dr. Yakubu. I think this is a very, very important aspect of our activities as a society. I was speaking to one of our nurses and asking her to join the meeting today. She was like, oh no, we the Momo doctors assem. And I think it's very important that the message goes out that this is a pediatric society activity. The aim is not for those aiming for fellowship. It's that the target is not post membership, etc. It's really for us to improve our output in our individual facilities and together as a society so that we can generate evidence to inform policy. We can get our name out there. We can win grants for society activities, etc. So please, when you speak to your colleagues, you speak to your friends, remind them that the aim of this is not a Ghana College or West Africa College activity. This is pediatric society activity. I would yield the floor to Dr. Yakubu or Dr. Boy to give final comments, and then we can all sign out. Thank you.
Okay, thank you, Charles. I'm currently on the route, so I will ask Dr. Boy to.
Thank you very much. So, Prof. Tope and Prof. Kenu, Dr. Adolate, and all those, the faculty who joined, just to say we are very grateful. I know you are all super busy people, and for you to be able to commit to do this for us as a society, we are truly very grateful. We hope that at the end of the day, many more of us will be empowered to do the research, and that out of the collaborations, we'll get many publications together as faculty from SPH and then members of PSG. Thank you, Dr. Martin Dickens and then Dr. Yakubu for the excellent job as chairman for the committee. Thank you very much. And to the executives, everyone who joined, thank you.
Thank you all once again, and we will see you next time on our next call. Thank you again, Profs.
All right, then. Thank you also, and being a good audience. Thank you.
Thank you, Prof. Bye-bye.